Hi, I am Erin Mullins, and today I'm going to present my slideshow of an analysis of the Choosing Wisely health campaign. I decided to choose this campaign because I think that healthcare is something that everyone deals with, but it bankrupts so many people, and we have so many issues in America with it. So this is the Choosing Wisely group, and they're a group that help physicians and patients work together to make the best medical decisions. So they're not just getting what their insurance wants, they're actually getting what's right for the patient, and this helps them to have better health and save money. So it basically promotes these conversations to choose care that's supported by evidence, it doesn't cause harm, and it's really needed. And it's not just doing the same thing over and over again. So like you don't need 12 MRIs or whatever. Um, and it may not seem like this is important, but making the wrong medical decision in the end and doing something that's unnecessary, that unnecessary thing could make your condition worse, and that could lead to even death. And further, an unnecessary procedure could cost tens of thousands of dollars to the hospital and patient. So this is actually really important. So the reason I chose this is even though the ad I chose is not local and it's based in Canada, uh, the group is like it's worldwide. And the Washington Health Alliance supports Choosing Wisely. And the Washington Health Alliance is sort of a local group within Washington. And they've worked really closely with Choosing Wisely. So even though my ad example isn't from Washington, the campaign itself, Choosing Wisely, is local. So what is the Washington Health Alliance? How does that show that it's a local campaign? So the Alliance is a nonprofit, nonpartisan organization. It shares the most reliable data on healthcare quality and value to help providers, patients, employees, and unions make better decisions about healthcare. And as you can see, they worked really closely with Choosing Wisely. And basically, what that means is they just look at all the healthcare data and they're helping people in Washington to understand like what is your insurance like, what's good healthcare quality, and just to sort of demystify the healthcare process. And that's why they really partnered with Choosing Wisely, and that's why Choosing Wisely is so relevant to Washington. And so, as I said, Choosing Wisely is a worldwide group. There's even Choosing Wisely in Australia, but my example just happens to be from Canada. And it says more is not always better. There's three different images. One's a hot dog with way too much mustard. One is a washing machine with way too much bubbles. And one is a man who's really struggling to lift a weight. Like he can't do it. He's probably going to hurt himself. So this is the ad, but I just wanted to show an example of a graphic, a couple graphics of Choosing Wisely that sort of illustrate what the campaign is about. So as you can tell, they're working for looking for the most effective and efficient care for a patient. And uh, so one thing Choosing Wisely did, this is the ad, but I just want to provide some background on them, is they worked with these two clinics and they got them to actually, by changing how the orders were managed and how doctors gave the orders, the imaging for low back pain, headaches, and blood transfusions and bronchitis went down. This may seem like a bad thing, but for example, there's one back surgery that's been found to be like totally unnecessary to patients, but they keep getting it and getting it. The back surgery does nothing to help them. It's actually all a placebo effect. So doing these only when they're necessary is good. And so again, here is our ad. And so getting some first impressions of our ad, it's simple. There's large lettering, repeated math messages, and clear graphics. Like there's a clear distinction between each image. It's very bright. It catches your gaze, but it's like it's simple. You only need to look at it for about 10 seconds to understand what the ad is. And so we can analyze this using different models. Um, for example, the integrative model was discussed in one of the class PowerPoints. So there's an infinite amount of things that can influence whatever you do, like what you have for breakfast tomorrow. But like even though everything that's ever happened in your life influences what you have for breakfast tomorrow, it's not a big deal. Really, there's a few main factors that will influence what you have for breakfast tomorrow, like say how hungry you are, how much time you have, and what you have in the fridge. So those are the three main factors that are actually going to determine whether you say have eggs or cereal for breakfast, and all the other infinite factors, they really don't matter as much. And so the integrated model is focusing on those important statistic factors. So it's focusing on attention and behavior. So not only do you need like the intention to do something, but you need the skill and the environment to make it happen. For example, if you're a kid and you're doing soccer and your coaches are nice to you and you practice every day and you're going to get better and your intention is to get better at soccer, you'll become a star player. But if you do soccer and you have a really mean coach who bullies you every day and you never show up to practice, even if your intention is to get better at soccer, you're not going to get better. So your intention and behavior, they have to kind of work so they can match. So attitude is how favorable or unfavorable performing the action would be. Perceived norms are what one thinks you should or shouldn't do, like we walk on the sidewalk, that's a perceived norm. And self-efficacy, how much someone believes they can perform an action. And these are three of the main factors in the integrative communication model. And so if we look at this, look at this ad, I think which factors one of it's really trying to focus on is perceived norms. It's trying to get people to realize that healthcare can be ridiculous by showing these three graphics where, you know, that dishwasher or is clearly ridiculous. That hot dog, no one put that much mustard. So they're trying to get the perceived norms to change by using such funny images. And then self-efficacy. So in this case, they're trying to get someone to stop a behavior. So the graphics show, don't do this. Don't use the mustard. Don't do this. Don't do that. They're trying to show, don't use too much healthcare. So they're trying to convince the viewer that actually they don't need to do all that extra healthcare. And so in that way, the ad is effective. And then there's other behaviors that can influence like gender, personality, and media exposure. And I don't really see how much this ad takes that into account. You could say maybe media exposure, it's towards a Canadian audience, but it looks pretty universal just for any of these secondary appealing to the secondary traits is just appealing to any group. And so next we're going to analyze the extended parallel process model, which was discussed in another PowerPoint in class. So I think the best way to go over the extended parallel process model is just a simple graphic. So you have a message component with there's the first appraisal, there's the second appraisal, and either the message is rejected on the first appraisal, it's rejected on the second appraisal, or it is accepted. And the extended parallel process model uses fear-based approaches, and sometimes fear-based approaches have been found not to be the most effective. And while this ad isn't totally about fear-based approaches, it does have some fear, right? Like that man, he can't lift the weights, he's gonna get hurt. That dishwasher is totally gonna mess up your house. And so there is a bit of a threat, even if it's not the scariest threat. So there's a threat, but its severity isn't super high. But the thing is, that's almost good because the ad is preventing the threat as like the severity. It's not the worst thing ever, but also it shows you're very susceptible. Like anyone can be active, anyone can eat a hot dog. That helps to realize that, oh, this is going to happen to everyone, but it's not so hard I can overcome, because even though the consequences can be really bad, like right, like the water in the dishwasher going everywhere, the severity of the issue isn't that big, in that it's really easy to solve. So they're telling people, oh yes, be afraid of this, yes, it can happen to everyone, but it's really easy to solve, and that will help the message to be accepted, which will result in behavior change of people using less healthcare. So the final framework we're going to analyze is gain frame versus loss frame. There are some mixed results on gain frame versus loss frame, but we're going to focus on Kahneman's and Tversky's 1979 prospect theory, which was mentioned in the lecture. And basically, so like if something is framed as you are going to save 400 lives by choosing this option, people are like, oh yes, even if it involves risk, even if 200 could possibly die, there's a 20% chance 200 could die, I will go for the 80% chance of saving 400 lives because I see gain when it's phrased that way. But if you say, well, there's a chance that if you say, oh, there's a 20% chance that all these people will die, and there's an 80% chance that all those people won't die. They just see loss, and they're like, no, 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 we can't do that. We can't take the risk. So getting people to do a jump where they're taking a risk, you have to frame it in a positive way. So maybe the mixed results were because they weren't framing loss versus gain correctly. So basically, this campaign, it is trying to frame it again in a way that's like non-threatening, and I think it's trying to do it in a way that's positive. It could have shown much more horrible examples, like it could have shown graphic images of bad medical procedures, but they're trying to look at this gain-framed approach where it's more lighthearted. So you think, oh, what do I have to gain? Instead of focusing on all the negative that would be in a more severe image, you think, what do I have to gain? Oh, I'm saving myself money. I'm saving myself my health. And because you're focusing on what I have to gain, then you are like more likely to do what the campaign wants you to do and reduce your healthcare. So again, just want to review the image so you could see what I'm talking about and how, it's threatening, but not too threatening. They're focusing on what you have to gain. It's talking about the same is true for medical trusts and treatments. Talk to your doctor about what you need and what you don't. So it's focusing on what you need, what you don't. It's a gain. It's not talk to your doctor about how medical care can harm you. It's a gain-framed approach. And so finally, I just wanted to discuss the model in class that didn't fit this with the ad, and that was narrative models. There's not really narrative in this. It's three separate things. It's not a story. And these are my sources. Thanks.